accidental extubation, it can lead to serious consequences in intubated patient, like reintubation and incidents of VAP are increased. So, what's the current issue in the next slide? It was like to reduce the unplanned extubation. Unplanned means the self-extubation and also the accidental extubation in mechanically ventilated patient in ICU. Our data in the first and second quarter of 2023 showed that the accidental extubation was almost 10.7% to 11.4%, which was really very high. And our goal, on the next slide, we can go, was to reduce unplanned extubation with the objective of reducing at least 50% from the current, which was 10.7 in first quarter. And the timeline of the project was 2023. However, we carried out to maintain the project, to maintain decreased self or accidental extubation. In our next slide, what intervention we did is that we first made a checklist to see what was our issue, where are our problems, that what's making it patient to self-extubate. So we analyzed few points, which included like pain, agitation, and delirium assessment and management was like not adequately managed, sedation vacation process, weaning and extubation process, and frequent orientation to patient and family engagement. This was the action was done based on our observation. So the nursing staff awareness was done about patient pain assessment, agitation, and delirium, including the physician and the respiratory therapist, because we all are in the same team and group. We look at the resources, we look at the process, and we achieved the results, which was very significant. The goal was to reduce 50%. However, we could reduce to 4.3, and in the last quarter it was 2.5% in 2023, and in the 2024 it was even less than 2%. The graph is there in the next slide. So what we focused on, yeah, you can see this is 2023 data. There is number of extubation like 28, 35, 23. These are the number of extubation, and the green one is the percentage. These are the number of successful extubation in the ICU. The number of accidental extubation you can see down the light green line, 3 and 4 and 1 and 1. So it was only one accidental extubation in fourth quarter, and similarly 2024 also we could maintain the data. So what was our issues, or what was the challenges we faced during this project? The first thing was assessment of pain, agitation, and delirium. It was very crucial to keep the patient calm and cooperative. Delirium and anxiety, restlessness can increase the risk of self-extubation. These patients had either sedation vacation or sedation vacation was discontinued to assess readiness for extubation. The patients were assessed for sedation level using Richmond Agitation Sedation Scale, and the nursing trainees, intern, physician, and other members facilitated in assessment of delirium, because the language, it needs really people around to assess the attentiveness and disorganized thinking. So the patients were made aware about extubation to relieve their anxiety, and they were frequently advised not to pull out the tube, and we are assessing and we will be the one to remove the tube, inshallah. So, and then these patients were prioritized in nursing care, yani the ratio. If the nurse is handling two patients, then we had like a team leader or a nursing intern to be beside patient at least during sedation vacation time. Communication was another important thing that we deal with. Sedation vacation was performed usually in the morning for all ICU patients. So then when we discuss in the team that we will be performing for like most stable patient first, and then later another group of patient. We divided the time of sedation vacation, so it will allow members of physician, nurses, and respiratory therapists to be more available during that time. So compliance to sedation vacation protocol, like abruptly discontinuing sedation, was monitored, and we follow the protocol by reducing 50%, 25%. So it helped, the patient to keep calm and be aware also. The next was ventilator weaning issue. We discussed that sometime the RT will start the weaning depending on the criteria, and then it takes long time. Either they are busy, they went for CT scan, or they are yani busy with other patients, and then this patient is already want to extubate himself. Since in the project the RT must be there during extubation, so we prioritize weaning process accordingly so that patient can be promptly assessed and extubated. Restraining patient, we observed that if we restrained the patient, they were able to cough out and extubate themselves. So, availability of family member, we engage family members, and it was really helpful because of the familiar sound, because of the familiar people, and the family touch. The patients were more cooperative during sedation vacation time. Nursing ratio we discuss, and availability of ETT securing device also was one of the issue that we face. We dealt with. So we achieved this, and we have sustainability plan to keep nursing observation during extubation, sedation vacation and extubation time. Delirium assessment by both nurses and physician, compliance to sedation vacation protocol, timing of weaning from ventilator, family engagement and their presence, availability of resources, and after each time the patients are self-extubated or self-accidental extubated, we discuss the what happened to this patient and how it went on, so we can do better. So that's how we are able to maintain below our benchmark the percentage of self and accidental extubation. Thank you so much for having me, and let me know if there is any question. Thank you. Hello.
Hello. So, is there any questions for Michelle?
I hope things are clear. Alhamdulillah.
Yes.
Thank you so much.
Yeah,
So
thank
much.
you so much. So, now moving on to our next speaker. It's our great pleasure to introduce Dr. Evangelia Micaldo from Nicosia Polyclinic, Cyprus. She'll be presenting on the topic entitled Intensive Care in Obstetric Cases, which is a plan for tackling maternal mortality. And we are very delighted to have her. Oh, so I just got an information that Dr. Evangelia is not here, and so we'll be having Dr. Anna Toker. So just a second.
All right, hang on a second. Let me turn on my camera.
Yes, please.
Oh, there I am. Okay, perfect. Well, good morning. Good afternoon. We have a little bit of a time zone difference. Um, Thank you for inviting me, and I know I'm running a little early, and I will try not to take too much of your time. Do you want me to go ahead and get started, or what's the protocol?
So if you wish, I can give you a brief introduction about you.
Brief introduction. Why not?
Okay.
Yes.
So let's welcome Dr. Anna Toker. She is founder of the online gut health platform Gut Check in United States. She'll be presenting on the topic Gut Check, a patient's guide in controlling their master switch for improved health. So Dr. Anna, now you can start.
Okay. Well, thank
Yeah.
you very much for inviting me. It's a pleasure to be able to speak to everyone today. And a lot of what has gone on in the last 3 days has been clinical information, guided towards physicians and scientists and whatnot. And so what I wanted to do is present a means by which physicians and practitioners can educate their patients. This is a probiotic driven conference, so I thought I would give that on digestive health in regards to the microbiome. Now, I am a colorectal surgeon in Dallas, Texas. My name is Dr. Anna Toker. I've been in practice for 22 years, and in the course of the last 22 years, there are a lot of patients who will come to me after seeing multiple doctors and being told they don't know what's wrong, go see someone else, whatever. They get to me thinking they might need surgery, which is a rather radical and desperate thought when everyone has told you nothing is wrong. If there is no surgical problem, I really am not the kind of person who can send the patient out of the room without help. And so over the years, I've kind of designed not really a formal presentation for patients, but an ongoing collaborative conversation with patients on how to improve their health. And so we'll base that on, let me share, can I share my screen? I should share my screen so you can see my slides. Hang on a second. Where would that be? Am I allowed to share my screen?
Yes, please.
Surely. I'm looking for it. Normally it's in the, oh, there, gee whiz. Okay, sorry. Okay, let me get to that screen and then let me turn this into a full size presentation. Just a second. That is sitting right on top of my, okay. And can y'all see that is the question. I'm hoping.
Yes, yes.
Perfect. Okay, good. That's perfect. Okay, so I'm going to build this concept for your patients on it. If you build it, they will come. And that's kind of in standing with, look, your conference is there in Dubai, arguably the most fantastic city in the world, right? If you build it, they do come. Here we are coming from all over the world to your city to give conferences and share information. And so, how do you build such a thing? You build it in a very specific way, and I would argue that your health is no different than building the city of Dubai. It takes a lot of planning, it takes a lot of hard work, there's lots of investment in yourself, and the microbiome is no different. As a background of the microbiome, this is kind of a new frontier in medicine, I'll be honest. I have a master's degree in microbiology. When I was in graduate school, a lot of the guys who finished our program with their PhDs went to California to join the Human Genome Project, where basically the endeavor was to sequence the entire DNA of the human. When that completed in 2003, you had a lot of well-trained scientists and all the equipment and no more project. So they turned their attention to the majority of the DNA that is actually in your body. So if I were to extract all the DNA in your body, only 1% of it would be you. The other 99% of it would belong to your microbiome. It is a huge host of diverse organisms, trillions and trillions of organisms. All of them are reasonably unique, and most of them we knew nothing of until the last 20 years or so. What is interesting over the years as we are studying this, it appears that all human disease will have a microbiome fingerprint or signature, and which does have diagnostic implications going forward. Is it possible that in the future it'll be a home stool study test to diagnose certain diseases? And that is what they are implying when they mention this fact of a microbiome signature. Certain organisms, of course, are going to be associated with infectious disease. We already knew that. But there are certain organisms associated with chronic disease. So MS recently has been associated with a particular bacteria. There are organisms that are associated with extraordinary health, and you may have heard of the Akkermansia muciniphila everyone's talking about. And so you can manipulate the microbiome to to maintain health, to improve health, and to bring on types of health like normal body weight. And this, of course, that means you can make money, which means here comes the marketing. There are thousands of products out now that are prebiotic and probiotic, and the people who started putting postbiotics. Postbiotics are the byproducts of metabolism that bacteria make that your body actually likes. When they start putting postbiotics in your supplements, they are acknowledging that you cannot just throw good bacteria into a system and expect it to work any more than you could throw a fancy restaurant in the middle of a bad part of town and expect it to succeed. So there's a process that has to take place. Now, prebiotics, probiotics, postbiotics are something that God gave you when He created the world and all of us humans. So you don't need necessarily to purchase something to get these things. It's in your food, it's in your environment, and in a healthy system, it is in balance. When you get confused by the marketing and you just start cramming down a bunch of supplements, they may not work as you think they are. At the worst, you're probably not hurting yourself, but at the worst, you're wasting quite a bit of money. So the concept is, how can you support yourself? How can you achieve the health that you want to achieve? And can you do it reasonably, naturally? And then you, as physicians and practitioners, like, how are you going to bring this to your patients? And what I'm arguing is that the microbiome has to be built from the ground up, much like a modern city would have to be built from the ground up. And if you build it, these organisms will naturally come. That's just the system that has been designed for us. Now, in the world of city planning, you can imagine open space before Dubai was Dubai. Someone had to have a plan, and it started with law enforcement, believe it or not, because you want to start on good footing. You have to have rules and regulations, and there needs to be, roads that function, and a tax structure for the businesses to pay for everything, and clean streets, and everyone has to have pride in their neighborhood. And then ultimately, people start moving into the place, and the schools get better, and the medical services get better. And the next thing you know, wealthy professionals, entrepreneurs start moving to town. More and more elite commerce comes in. And the last thing that happens actually are the fancy restaurants and the Lululemon and the Hermes of France. And these are sort of the crown jewels. You can't sprinkle those in the middle of a field and expect the city to pop up around them. You build the city first, and then the crown jewels show up. So these crown jewel businesses are similar to this Akkermansia muciniphila that everyone's talking about. You can't just sprinkle that into a disaster GI tract and expect the patient next week to be normal body weight and perfectly healthy. It's just not how that works, and that's not really what the marketing would lead you to believe. Okay, so if we're going to build a microbiome in the same way we build a city, well, you need law and order. In the intestinal tract, inflammation is the crime, right? That's the enemy is inflammation. And inflammation in the modern world is all around us. Um, the food that we eat, artificial sweeteners, artificial colors, the chemicals that we spray the fields with to kill insects and weeds and that sort of thing. All of those things are inflammatory. Highly processed food is very inflammatory. And the way they cook that food and process that food to put it in a package for you is very inflammatory. So, inflammation is the enemy. You want to remove this inflammation. Inflamed tissue doesn't function properly. And so, if you want normal function, you have to remove the inflammation. The second thing that you need to do is, in addition to removing inflammation, you kind of have to replace those inflammatory things with non-inflammatory things. So instead of getting a processed meal ready to eat, you should maybe be cooking that at home. You're going to replace the concept. It's the same meal, except you're making it. This replacement has a tendency to avoid inflammation. You can also avoid inflammation with certain anti-inflammatory herbs like turmeric and that sort of thing, resveratrol that you might find in grapes. Um, You'll want to optimize the absorption of nutrients. And so to do that, you have to break down your food. You have to have good blood flow to the area. You have to have good oxygenation to the area. And again, if you're eating clean food ingredients, if you're chewing your food well, then the system will naturally create a natural pH gradient. And as long as you're hydrated, and maintaining a good blood flow by hydration. And you can take, again, red grapes are high in resveratrol, so are beets. You can take supplements with resveratrol. These things increase your oxygen tension within the tissues, and that can help decrease inflammation as well. So you want to remove and replace inflammation so that you can break down your food and absorb nutrients better. That's step number one. The second thing that you want to do is reinforce the lining of the intestinal tract. So, the enterocytes is a single cell lining that is protecting you from stomach acid and bile and bacteria and all those toxins. It's a very fine line. And in the presence of inflammation, that fine line gets broken. And that inflammation is what ultimately leads to chronic illness. So if you want to avoid chronic illness, this step, this reinforcing the enterocytes, is critically important. And this kind of is the same thing as having, by the time you get to this point where you're like shoring up the basement membrane and the enterocytes in the city urban development plan, is kind of like having clean streets and good schools in the healthcare system, right? This is a basic necessity, right? So we've gotten rid of crime, we've got an organization, and now we're building streets, we're building schools, we've got a hospital system. So that's what removing inflammation, replacing those things with non-inflammatory foods, and then reinforcing the enterocytes. You can reinforce, and we'll talk about what patients proactively can do to feed these enterocytes, but it all comes down to utilizing the microbiome with the food that you eat will help feed these enterocytes to strengthen them. Then we'll be talk about that in a few minutes. Part of reinforcing the enterocytes, of course, is stabilizing the basement membrane and collagen support. And again, when you have this leaky gut, this broken down enterocytes, this is what leads to autoimmune disease and cancer and diabetes and fatty liver and metabolic syndrome. All of that starts with inflammation in the GI tract. So the reinforcing the basement membrane and the enterocytes is super duper important. The next thing that you need to do is replenish the bacteria that are in the system. That means you need to stop killing the good guys and then proactively add in more good guys. So you don't, when you consume processed foods, artificial sweeteners, artificial colors, these things are actually toxic to beneficial bacteria. So you'll have to engage in proactive behaviors that stop this death cycle of beneficial bacteria. And this is where probiotics come in, whether you're taking yogurt or sauerkraut or kombucha, which are natural fermented foods, or you're taking probiotics in a pill. Anything that you can do to replenish the bacteria that's in the GI tract will help you. The microbiome is a source for all of your neurotransmitters. It is also a source for the food that feeds the enterocytes. And so you want as many of the beneficial bacteria as you possibly can get. The microbiome works in a balanced format. As you get more and more of the beneficial bacteria, that actually helps improve breaking down the inflammation, reinforcing the enteric membrane. You've just sort of built your little city, and as it becomes more and more stable, you start inviting those beneficial bacteria like mucinophilia into the body. And so if you'll look on marketing materials for products that state they improve mucinophilia, there's no mucinophilia or there's no Akkermansia mucinophilia in those probiotics. They can't. It's that is an anaerobic bacterium. What they have in those products is a prebiotic, a probiotic, and a postbiotic. What they're trying to do is remove inflammation, reinforce the enterocytes, and replenish the microbiome, just to give you an understanding of the logic behind some of those products. And they can be quite expensive. You can do this on your own. Okay, so you don't have to spend that kind of money. And in some parts of the world, that stuff is probably not even available. So you can train your microbiome. This microbiome is the master switch to your health, to your mental state, your ability to focus, your ability to sleep. All that comes down to a proper microbiome. So I have all my patients do something called microbiome testing. And where you're from, I don't know which companies do that sort of a thing. There are some doctors in America that will run their own clinics with microbiome testing. I am a surgeon by training, so I really do not have time for that type of detail. So I use a service that interacts with the patient directly. The one that I particularly like is on my website, but basically they mail a kit to the patient mails that kit back, and there's a little app where they answer health questions. And then that company breaks down the microbiome for the patient, tells them what they need work on, and then actually gives dietary advice based on those findings. That is very helpful homework that the patients can do. And again, I don't have a medical practice, I have a surgical practice, so I make my patients do a lot of their own homework, to be honest with you. It's also why I do a lot of videos because I can say it once and then refer patients to that, and they can kind of do their own homework at home. So, what is practical advice that people can start from in addition to knowing their baseline microbiome testing? That testing is only good for about 6 months. You have to repeat it frequently because the microbiome is forever changing. As you change your diet and your ways, and you remove stuff and you replace stuff and you replenish stuff, the microbiome will completely change as a result, and you'll want to track that. So the patients have to understand it's not a one-time test. What they can do is add a clean diet, organic, non-GMO. So, in other words, that's not sprayed with herbicides and pesticides. And the Europeans do a really good job of protecting their food supply. The Americans, not so much. Like we have to go hunting down specifically to make sure we know who grew the food, how did they grow it, how do they process it. The food supply is becoming global, so I would just say buyer beware. We do some stuff awesome in America and we do some stuff horrible in America. So you just have to know the source. Sometimes the price tag will tell you. It costs a lot of money to grow crops in a normal way. And so very inexpensive food, unfortunately, is oftentimes contaminated. When it comes to hydration, that is critical, and it's not just water. You'll want to have natural minerals as well. One of the problems with the herbicides that we use to treat the fields to make farming easier is that it impedes your ability to absorb micronutrients, particularly magnesium and calcium and zinc. So you will have a micronutrient deficiency as a baseline. Almost all of my patients do, and I make everyone take a hydration salt mineral. They can put a little Celtic sea salt in some water just to replenish that if necessary. Oh my gosh, my alarm is going off. Sorry. Okay, sorry for that interruption. Other things that people should do is actually do full fat dairy. A lot of people will do the skim milk because they're scared of fat, but it is dairy fat that has a tendency to promote short chain fatty acid, butyrate in the GI tract. And so there's nothing wrong with full fat dairy. Soluble fiber, however, if you don't do any dairy at all, will also stimulate butyrate formation from the microbiome. Try to get as many fresh fruits and vegetables as possible. Fruits and vegetables contain phytophenols and polyphenols, and these are considered food and energy source to beneficial bacteria. Fermented foods, of course, will have prebiotics in there. That's the soluble fiber. We'll have probiotics in there, which are good bacteria that are beneficial for you, and will also contain some of the postbiotics. You can make your own fermented foods at home quite easily. It is an ancient craft. Again, the point is you don't necessarily have to fall for the marketing. I would say, and as a special note, there's a little bit of an alarming finding that, and I don't know why. I don't know if it's COVID itself, or if it's the vaccine, or if it's new medications that may be out there, and who knows. But there seems to be a shortage of Bifidobacterium infantis going on. So if you've had COVID and you're struggling with long COVID, for example, you may want to do microbiome testing looking for this particular bacterium because the absence of this bacteria leads to chronic illness. It is the foundation of your microbiome. It's supposed to be present when you're born. And right now, 25% of babies are born without this bacteria, which seems very unnatural. And of course, these babies are destined to poor health. So if you have young children at home, it may be worth promoting Bifidobacterium infantis. You don't necessarily need to test everyone, but you can take prebiotics. You can buy these commercially available human milk oligosaccharides. It doesn't come from human milk. That basically just take glucose and in a chemical reaction can get to this fucosilactose. This is the food that Bifidobacterium infantis loves, and it will grow in abundance in the presence of that prebiotic food. And it's available, in your local health store and online. So if you're struggling after COVID vaccine, if you have children, I don't know, and maybe their stomachs aren't right, something's not right. They may be one of these group of kids that just don't have this bacteria for whatever environmental reason. Try to support them as much as you can with prebiotics. You can take Bifidobacterium as a probiotic as well. So the important things for everyone, I hope I didn't go over time. The most important things for people to know is that the microbiome is constantly in flux. You will need to test it every 3 to 6 months if you're being scientific about it. So if you have someone who's really, really struggling, it is actually beneficial because you can change your diet and what you're doing kind of based on those results as you improve. You can go to a physician or a wellness practitioner and get in-person guidance. You can use the online service like I do. I am sure in the modern era they will have AI modules that do the exact same thing, but that kind of guidance really is extremely helpful to the patients in some form or another. So that's all I have. Do y'all have any questions about that rambling report?
So, hi Anna, it was a really insightful session. And I just want to ask that you mentioned that 1% of our genetic material is human. So,
Yeah.
how does the remaining 99% of the microbiome DNA influence our gut health?
Well, it's so each of those, the 99% DNA activity basically tells you how much diversity there is into the microbiome. That is all unique DNA sequences. We don't yet know how the mRNA and DNA of the microbiome affects us, but you know it has to. You know it has to. There are viruses that are in there, bacteria and fungus, and it is still very early as to how are we affected by that, because as bacteria die, of course, they shed mRNA and DNA. And so I don't know that that part of the microbiome is understood extremely well, except to say, you know, it happens. Now, the bacteria themselves, as they metabolize through things, are giving you neurotransmitters and vitamins and cofactors. And so when you are missing certain bacteria, you are missing things your body needs, and all of a sudden your body responds with a diseased process. There are some diseases that come first and then it alters the microbiome, like stress, for example. Stress can destroy your microbiome. So you can take a normal person, put them under extreme amounts of stress, destroy their microbiome, and now all of a sudden they have anxiety disorder, et cetera, et cetera. So we don't know, it's chicken and the egg, like which comes first, the bad microbiome or the disease, but the two are definitely corollary. And I think one day there will be probably diagnostics based on that.
Okay, thank you. Acha,
Mhm.
one more question that you also emphasized on feeding enterocytes.
Yeah.
So, can you explain their role in protecting our gut lining and supporting
Yes.
our microbiome health?
Yes, of course. So the enterocytes, those are the cells that line the intestinal tract, and they do not get their nutrients from the blood supply like the rest of your body. They get nutrients from they're staring at it, right? They're the first ones to get access to the food source. But their preferred food source is an amino acid called glutamine and a short chain fatty acid called butyrate. Those two things are the preferred items of the enterocyte. So for my patients that I'm getting ready to operate on, I will have them take prebiotic fiber, inulin fiber, usually. It's pretty inexpensive. When you take inulin fiber, your body is naturally going to make short chain fatty acids. The microbiome will naturally make that. That will feed the enterocytes to strengthen them, to strengthen those gap junctions between the cells and limit leaky gut. And the second thing that I will have them do is take a glutamine supplement because that has a tendency to help those patients feed the enterocytes directly. But you can get that from the food that you eat. When I have to operate on someone, I've only got 2 weeks to get there, right? So like your surgery's in 2 weeks. So for the next 2 weeks, I want you to do this and this. And that's one of the things that you can do for that.
Such a last thing that in the final stage of microbiome building, why is
Yes.
microbiome diversity called crown jewel of optimal health? I mean, why?
Because when you take a person who is in optimal health, they have a very specific microbiome fingerprint, and it includes two or three very specific organisms. The most popular one that you will hear described is Akkermansia muciniphila. That organism is an anaerobic bacteria. It lives on the mucus lining of the intestinal tract, but your intestinal tract, when it's inflamed, does not make this mucus lining. Okay, so you have to have a healthy intestinal lining to make the mucus that will feed this Akkermansia. So if you can get your GI tract healthy enough to support Akkermansia, that's the crown jewel. Like if that means you've gotten there, you've gotten to the peak of society when it comes to microbiome health, and that means your personal health is very likely to reflect in that, if that makes sense.
Yeah, certainly. Thank you. That was, really wonderful hearing you. Thank you so much for all the lessons, I must say,
It's my
for
pleasure.
this.
Thank you for inviting
Yeah.
me. I enjoy it.
Yeah, thank you. Thank you. So,
All right, we'll see you guys. If y'all have any questions, always email.
sure.
All right.
So I guess Dr. Evangelia is available now. So it's a great pleasure to reintroduce her, Dr. Evangelia Michaldu from Nicosia Polyclinic, Cyprus. She'll be presenting on the topic Intensive Care in Obstetric Cases, a plan for tackling maternal mortality. And we are very delighted to have her with us here, and we very look forward for her valuable insights. Dr. Evangelia, please start the presentation. So, dear audience, actually, Dr. Evangelia is in some emergency and she'll be here with us in like 5 minutes. So, it's a request to please wait patiently and she'll be here shortly. Meanwhile, if anybody wants to share their experience with this conference, um, you're most welcome. And any suggestions or anything will is like more than welcome from any of the audiences. So, due to a medical emergency, she is unable to present here, and therefore we are sharing Dr. Evangelia's presentation slides. So thank you, admin. And our next speaker will be Mr. Hamid Neher Al Harbi from Saudi Arabia. Mr. Al Harbi will be presenting on neuroimaging biomarkers of the gut brain axis, assessing probiotic therapy outcomes with MRI and advanced techniques. And we are very delighted to have him. And we really look forward to an insightful and informative session. Uh, Please welcome Mr. Hamid. Mr. Hamid, please share your screen and start your presentation. So, due to some technical glitch, Mr. Hamid was not here with us. Mr. Hamid, I guess you are here now. Mr. Hamid is our
Yes, I am with you.
yeah. So please start your presentation and share a screen. Thank you so much.
Yeah, thank you for letting me presenting these small topics about neuroimaging biomarkers of the gut-brain axis, assessing probiotic therapy outcomes with MRI and advanced technique. This is a systemized study that we looking for MRI abnormalities or findings on function MRI by according to the effect of the gut that can increase activity in certain area of the brain. So, this systemic review exam how probiotics may influence brain activity and mental health through the gut-brain axis, a bidirectional communication system linked to the gastrointestinal tract and the brain via neural, immune, and endocrine pathway. Probiotic live microorganism with health benefit can alter gut microbacteria composition, reducing inflammation, modulate stress responses, and influence neurotransmitter production, all of which may affect brain function. So the review focused on randomized controlled trial using functional magnetic resonance MRI, including both task-based and resting state approach in health individual and clinical populations, such as those with major depression disorder and irritable bowel syndrome. In healthy participants, task-based function MRI studies show that the probiotics modulate brain regions involving the emotional regulation and cognition, including the amygdala, orbitofrontal cortex, and precuneus. Resting state function MRI study revealed changes in the functional connectivity, such as increased activity in the silence network and reduced activity in the default mode network. In healthy participants, task-based function MRI study showed that probiotics modulate brain regions involved in emotional regulation and cognitive, including amygdala, orbitofrontal cortex, and precuneus. The risk state function MRI study revealed changes in the functional connectivity, such as increased activity in the silence network and reduced activity in the default mode network. So in the clinical population, probiotics approach to normalized altered brain activity. Task-based function MRI study reported improvement in brain function related to mood and pain processing, while resting state study suggests enhanced connectivity in mood regulation region, including the subcallosal cortex, amygdala, and hippocampus. Despite these promising findings, the review highlights substantial methodological variability, small sample size, and limited longitudinal data across studies. While functional MRI provide an objective tool to assess brain changes beyond self-reported measures, stronger and more standardized research design are needed to clarify the causal mechanism and long-term mental health benefits of probiotic within the gut-brain axis framework. This is some images that show on the functional MRI that in the clinical population task-based functional MRI, there is some certain area that increase activity, frontotemporal region and precuneus, and the amygdala, also the frontal region, as we can say. And also, this is for the clinical population in the resting state function MRI that show the silence area that can show increased activity. And this is a brief about the importance of probiotics in the function MRI and how it can be affect the mode and the some changes that can be detected in function MRI. Maybe we need more study and more sample size to verify important findings that can be correlation with the mental health patient with the affection of the probiotics and gut health. Thank you for letting me sharing this.
Thank you, Mr. Hamid. It was an insightful presentation.
Yeah, thank you very much. Thank you for letting me present this topics today. Thank you.
It was a nice presentation. Okay. So, do we have Miss Susan Cass with us? Dr. Susan Cass? I guess Dr. Susan is not here with us. Well, no issues. We had a lot of interactive and informative sessions. So Dear participants, as we come to the end of day 3 of the online sessions of the gastroenterology, endoscopic, probiotics, healthcare, nursing, and pharmacy conferences, I would like to extend our heartfelt thanks to all of our speakers, poster presenters, chairpersons, and participants for making this event a great success. Your active participation and insightful presentation and engaging discussions have made this conference a truly meaningful one. We look forward to your continued contributions and hope that we'll meet each other in future events. So, thank you so much and goodbye. Now, I hand over to the admin.